Welcome to Content Managers Forum. This time, we will delve into avoid drug, doctor, and disease, a changing concept of healthcare. Truth behind medical choices. Part 1, a brief outline of the advancing medical care scene. In the quickly changing scene of medical care, the elements among patients and clinical experts are going through a groundbreaking movement. Gone are the days when people exclusively depended on the ability of specialists. Today, the coming of reputable online learning platforms like YouTube has democratized well-being data. Importance of informed choices in medical decisions. Grasping the ramifications of clinical choices, addressing treatment choices, and effectively looking for information have become indispensable parts of keeping up with one's well-being. In a world immersed with data, the capacity to recognize trustworthy sources and settle on informed choices has turned into a fundamental expertise for each person. Part 2, the changing dynamics of doctor-patient relationship. Traditional perceptions of medical knowledge. In the traditional model of healthcare, medical knowledge was often perceived as an exclusive domain of doctors. Patients would entrust their well-being to the expertise of healthcare professionals, relying on their guidance without actively participating in the decision-making process. The need for individuals to take an active role in their health. Amid this transformation, there arises a compelling need for individuals to take a more active role in their health. Patients are encouraged to question, engage, and participate in discussions about their health, fostering a collaborative relationship with their healthcare providers. Part 3, impact of drug companies on medical research and publications. The drug business' significant effect on clinical exploration and distributions could not be more significant. The monetary ties among specialists and drug organizations have at times compromised the objectivity of studies, slanting outcomes for explicit meds or medicines. Part V, challenging earlier health research. Critical analysis of earlier cardiology studies, revealing the intricacies of earlier studies that have shaped medical practices. This scrutiny is not intended to undermine the contributions of past research, but to subject them to a meticulous examination. By dissecting earlier cardiology studies, we aim to discern the nuances, limitations, and potential biases that may have influenced medical recommendations and treatment protocols. The consequences of blindly following medications. A critical juncture in our exploration is the examination of the consequences stemming from blindly following medications based on earlier research. The script highlights instances where individuals, guided by the recommendations of the time, may have unwittingly subjected themselves to treatments with unforeseen repercussions. The consequences of such blind adherence to medical advice serve as a cautionary tale, prompting a reevaluation of how we approach and trust medical recommendations. Part 6, the rise of healthy lifestyle approaches. Introduction of alternative approaches to health. Against traditional medical approaches, a refreshing wave of alternative methods is gaining prominence in healthcare. This emphasizes the concept of embracing alternative approaches to health, highlighting the need to move beyond a reliance on medications alone. The narrative explores how lifestyle modifications, dietary changes, and holistic wellness practices are gradually taking center stage in the pursuit of well-being. Focus on recent cardiology and nutritionist studies challenging earlier methodologies. A pivotal shift in our understanding of health emerges as recent studies conducted by cardiology and nutrition experts challenge the methodologies of their predecessors. By focusing on these contemporary studies, the narrative unveils a paradigm where alternative approaches gain validation. The critical analysis of these studies questions earlier methodologies and provides evidence for the efficacy of lifestyle modifications in preventing and managing health conditions. The logicality and benefits of adopting a healthy lifestyle. Drawing on the findings of recent research, the narrative illustrates how lifestyle choices directly impact health outcomes. From dietary considerations to incorporating regular exercise, The logicality of these choices is presented as a viable and sustainable approach. The benefits extend beyond mere physical health, encompassing mental well-being and overall quality of life. Part 7. Personal Experiences and Recommendations. Personal experience. The founder and owner of Content Managers received heart attack. In June 2009, when he was at 54, was evacuated to National Institute of Heart Diseases NIHD Rawalpindi, Pakistan. In the process of angiography, it revealed that there were 4 blockages needing stents. Therefore, 4 stents replaced. After a gap of 3 months, another heart attack came, and again he was inserted with 1 more stent, making it total of 5 stents. He felt better and was kept on medication, taking a handful of tablets daily. Till that time, he had no other health issue except heart blockages being dealt with. In April 20, by that time, he had developed diabetes type 2, fatty liver, prostate enlargement, and other minor issues, maybe because of side effects of medication. During angiography in NIHD, it was revealed that right coronary artery RCA was 100% blocked. Attempted patent ductus arteriosus PDA in stent restenosis ISR with guide wire could not pass through the lesion. So, he was left at the mercy of medication to open the blockage with substantial increase in the volume of the medicines. From April 2014 till 2016, with the administration of huge volumes of medicines, his health started deteriorating day by day. The diabetes type 2, liver disorder, and other minor problems started getting serious turn, and he kept going to his lower ebb. On the 15th of December 2016, he had a profoundly serious heart attack leading to incapacitation. Was rushed to NIHD, Rawalpindi, Pakistan after his stabilization. Angiography revealed RCA 100% blocked, center artery LX 70% blocked, and left anterior descending artery LAD 90% blocked. The bypass surgery was risky, that is why no heart surgeon was happily ready to undertake the surgery. He started getting opinions from different cardiovascular experts for heart bypass surgery. Meanwhile, on the 20th of December 2016, one of his friends who came to see him told him to use pomegranate seeds, known as anardana, in local language, for opening the arteries. He was told to take about 40 grams of pomegranate seeds anardana and soak it in TWO glasses of water at night. It may be noted that if you forget to soak it into water at night, you may boil it directly. In the morning, boil the same till about 1 glass liquid is left, stain it, and take the liquid in lukewarm state. Empty stomach, once daily for about 75 to 90 days. He started using the recipe daily and astonishingly started feeling better and better. After using this recipe, he got up from the bed after a few days, and after about 15 days, he started going to his office. Every day was better than the previous day. On the 24th of February 2017, he got admitted in Army Cardiac Center, Lahore, Pakistan for heart bypass. Although he was feeling totally fit and could negotiate stairs also. But still he wanted to undertake the recommendations of the cardiovascular experts to go for heart bypass. From the 24th of February 2017 to the 4th of March 2017, for about 9 days he was not operated upon. On a protest for not being operated on, he was told that his case was to be discussed by a board of experts on 5th of March 2017 to decide about the surgery. Finally, it was recommended to perform angiography again to decide for heart bypass surgery on the 6th of March 2017. During angiography, all the main arteries, which were 100%, 70%, and 90% blocked, found open miraculously. During this procedure, only 2 stents in RCA, which were inserted in 2009, found being narrowed, were inflated and inserted with 2 new stents, making the total stents to 7. By the grace of God, on the 7th of March 2017, he got out of the hospital totally recovered from heart problem without heart surgery. Till date, he is fit and fine. not only from the heart point of view, but also got rid of diabetes type 2, liver, and other minor ailments. Prostate problem is also under control because of home remedies in use. Since 2017, he started getting to know the home remedies to treat various health issues and was completely successful. Now, at 68 years of age, he is totally fit and fine. It was all possible because of the healthy keto diet and regular exercise and lifestyle changes. Inspired with his success, he got into the research, where he followed the renowned cardiologists and dietitians especially. Dr. William Davis, Dr. Nader Ali, Dr. Jason Fong, Dr. Yoshinori Osumi, Dr. Anna Maria Corvo, and Dr. Guido Kromer, for their innovative and appealing theories about well-being through diet, exercises, and lifestyle changes. He decided to share success stories on YouTube for the benefit of humanity. In 2017, after being successful, floated the recipe of pomegranate seeds and ardena on WhatsApp groups. The recipe went viral, and hundreds of people benefited from the recipe. Today, the first time the recipe is being floated on YouTube. Content managers already have videos on the YouTube advocating treatment of various disorders with diet, exercise, and lifestyle changes. Links for which are different articles on the subject are available for detailed reading at https://www.healthierhtips.blogspot.com. Detailed recommendations on diet, exercise, and lifestyle changes. Contents managers already have several videos on YouTube at SHAZAN88 and corresponding articles for detailed reading at https://www.healthierhtips.blogspot.com. Part 8. A systematic approach to health management. Integrating diet, exercise, lifestyle changes, and specific supplements into daily life. Central to this systematic approach is the integration of fundamental elements into daily life. Diet, exercise, lifestyle changes, and specific supplements. This integration forms a comprehensive strategy that aligns with the body's natural processes, fostering sustainable health outcomes. Part 9. The call for informed activity, the significance of progressive training in well-being choices. Necessary to this call for informed activity is a determined accentuation on consistent instruction. It emphasizes the meaning of continuous schooling as a unique instrument to explore the complexities of clinical choices. By encouraging an outlook of interest and a promise to learning, people are enabled to settle on informed and nuanced well-being decisions. This end marks not an end point, but rather an initiation. A source of inspiration for people, medical care experts, and society at large. It welcomes us to embrace a future where informed decisions prepare for a better, more enabled, and edified world. If you found this effort useful, please subscribe, like, and share for the benefits of others. Do comment for our improvement. Thanks for being with us. Take care.